Hi, I'm Chris from Physio7 and this is my quick guide to Achilles tendinopathy for runners. Check out some of our other videos for more in-depth treatment and rehabilitation options. The Achilles tendon is the big tendon at the back of your lower leg, attaching the calf muscles to the heel bone. First the deeper soleus muscle, and on top of that the big gastrocnemius muscle. There are two main sites that runners feel Achilles pain. The insertion, where the tendon attaches to the heel bone, and the mid portion, which is 4 or 5 centimeters up from the heel bone. This is important because the two areas respond differently to treatment. Pain in the Achilles tendon used to be called Achilles Tendinitis, but because it's largely a degenerative process and has only a limited inflammatory component, we now refer to it as Achilles Tendinopathy. Healthy tendons are composed mostly of tightly packed, parallel bundles of collagen fibres. Recent research by physiotherapy tendon experts Jill Cook and Craig Purdom has identified 3 stages to tendinopathy. First is the reactive stage, in which the tendon swells but the collagen matrix is intact. Next is the stage of disrepair, where the collagen matrix starts to break down, a bit like a fraying rope. Last is the degenerative stage, where there is severe breakdown of the tendon matrix and blood vessels and nerves start to grow into the spaces between the collagen fibres. The onset of Achilles tendinopathy can be sudden, but runners will usually describe a gradual onset in pain and stiffness in the tendon during or after running. At first, the problem may occur only after intense hill, track or interval sessions, and in the early stages, the pain may reduce as you begin to warm up on your run. Stiffness in the tendon first thing in the morning is a frequent finding in the early stages. But gradually the pain becomes more frequent and you can feel it throughout the full duration of runs, even slower and less intense sessions. Eventually you may experience pain just walking. The tendon is usually tended to touch. In the early reactive stage, the whole tendon may be swollen. Later on in the degenerative stage, the tendon may feel thickened with lumpy nodules. So what causes Achilles tendinopathy? Well, in runners, it's usually caused by the accumulation of excessive mechanical load on the tendon. That could be from an increase in your usual mileage, excessive hill, sprint or track sessions. It could be from a change in your usual running surface, or the addition of extra runs to your usual schedule. Have you recently joined the barefoot or minimalist craze and overdone it a bit? Or maybe those new trainers are pressing on the back of your Achilles. Or perhaps you've had an injury elsewhere, so now you're running differently and it's throwing more strain onto your Achilles. On the other hand, it's possible that the loading of the tendon is the same as normal, but that the tendon has become weaker after a break from running, or after a period of enforced rest after a different injury. Alternatively, there are other factors that have been shown to contribute to Achilles pain, such as a stiff ankle, weak calf muscles, tight calf muscles, or weak gluteal or hamstring muscles. Or maybe you just haven't been warming up properly. All these are possible factors in the development of an Achilles tendinopathy. Hopefully 1 or 2 will ring true for you, because identifying those factors is stage 1 in curing the problem. So let's look at some treatment options. First, I'm going to give you some tips for acute management for the reactive Achilles tendinopathy. So let's say that the morning after a tough hill session, you feel pain and swelling over your Achilles. What can you do? First off, avoid running and reduce the amount of walking you do for 3 or 4 days. You can use a 5mm heel raise to take pressure off your Achilles, and in a severe case you might want to wear an air cast boot for a couple of days. You can take maximum dose ibuprofen for 3 days if you're medically fit to do so. Check with your GP or pharmacist if you're unsure. It's worth saying that although inflammation isn't a big part of tendinopathy, there's good recent evidence to show that ibuprofen helps in this reactive stage. Additionally, many top athletes now take high-dose omega-3 tablets and drink green tea for reactive tendinopathy. Static calf muscle exercises, otherwise known as isometric exercises, can be started after 3 or 4 days, and if you respond well, normal training can often be resumed soon after. So what about treatment for a chronic grumbling degenerative Achilles tendinopathy? You will usually still need a period of relative rest from the activity that has been causing the problem. That might mean avoiding the problematic hill sessions or track sprints, or it might mean avoiding all running. It just depends on how severe things are. You can do some cross training such as swimming or cycling to keep up your general cardiovascular fitness and to help bring oxygen to the healing tendon. Even better, try something specific to running, such as aquajogging or the elliptigo. While resting from running, you need to build up the strength of the tendon, and for degenerative Achilles tendinopathy, exercises to gradually load the tendon are seen as the gold standard treatment technique. Eccentric exercises, such as the heel drops originally pioneered by Professor Håkan Alfredson, have been popular over recent years, and there is good evidence that they work well for chronic mid-portion Achilles tendinopathy, especially in athletes. Some of today's other tendon experts believe that concentric-eccentric exercises, such as a standard up and down heel raiser, work just as well as eccentrics, and they're easier to perform. We have other videos to help you choose which exercises you use, but whichever you plump for, you need to build up the loads on the tendon gradually. Usually that involves going slowly with low resistance to start with and gradually building speed and resistance. Eventually you'll want to build up to doing dynamic exercises such as hopping and skipping. Stretching of the calf muscles can be useful if those muscles are tight, and ice packs can be useful after runs or activities that might cause a reaction in the tendon. If you're still struggling, having tried some of those home treatment options, it might be time to visit a physiotherapist. Firstly, a physio will help you to accurately diagnose your problem and rule out other problems which require a different treatment approach. They will also help to determine the stage of the pathology, which guides the best treatment approach. The physio will perform a physical examination to help evaluate which areas are stiff, tight and weak, both in the tendon and calf and also along the whole of the kinetic chain. They can use various hands-on techniques to loosen stiff and tight areas and teach you specific exercises to improve strength and movement control. Make sure you visit a physio who either runs or treats lots of runners, because you need to see someone who will understand your training plan and your running objectives, and will link this to your medical and training history and to your current levels of conditioning, strength and flexibility. They might also evaluate your running style to work out if there are any biomechanical factors that are contributing to your tendinopathy problem. A good physio is going to be like a coach who takes you through all stages of rehabilitation. Treating Achilles tendinopathy effectively is largely about stressing the tendon the right amount at the right time, and a good running physio will help guide you through that process. They might also use adjunct therapies such as kinesiotaping, acupuncture, shockwave therapy or ultrasound to help healing of the tendon. I hope this has been a useful guide to Achilles tendinopathy. Keep an eye out for our other videos on this topic. Good luck and happy running.